Welcome to the Birth Squad podcast. If you're riding with the squad,
hey fam!
And if you're new,
welcome to the squad. We're your hosts, Dr. Ijama Okwando and Dr. Kanisha Thomas. We're two licensed obstetrician and gynecologists, as well as best friends.
The Birth Squad is a podcast for birthing individuals by two Black female physicians who use stories from real women to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope that you love learning from our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. So please consult your healthcare provider for your specific care. And to learn more about us and about the podcast, please follow us on Instagram at The Birth Squad. And also check out our website, thebirthsquad.com.
Please keep in mind that some of our episodes may cover topics that could be triggering to some individuals. Listener discretion is advised. Well, welcome back to another episode of the Birth Squad podcast. We are super excited for this episode. I am honored and privileged to introduce someone that I have had the pleasure of working with regularly, and that is Dr. Nicole Christian-Genius. Also, she goes by Dr. Nikki for those who might know her a little bit better. She is unicorn. She's a certified midwife. She is got also a doctorate in midwifery and is one of two Black midwives to have accomplished this. So please enjoy every piece of information that she shares with us and listen up, because she has, I'm sure, a lot of wisdom to share and a lot of experiences to share with us. So welcome, Dr. Nikki.
Thank you, Dr. Thomas. Happy to be here.
So we'll start off by asking you to tell us about yourself and how you became interested in being a midwife.
Okay. So I am, like you said, I am a certified nurse midwife, one of only two Black women in this country to hold a doctorate in midwifery. We were actually in the first inaugural class for that discipline specific degree, and I became interested in becoming a midwife growing up as a child, hearing my mother share stories about her grandmother, who was the town midwife. My mother was like deathly afraid of blood. And so when she would be invited to go to these births, she was like, oh no, but her grandmother would sort of make her go. And so hearing these stories fascinated me, just the process, to love the care, even the bartering system that would be used to sort of, exchange this service for this service. It captivated me, and probably is like a direct, like it was just something that linked my mother and I as well, even though she was totally afraid of the gore of it all. She was sure to capture the gifting of it all. How my grandmother would grab her bag and grab herbs from a counter that was like in the kitchen windowsill, and would scurry off to someone's house and jump right in this sort of mother role over the mother who was birthing. And so it was just a beautiful thing for me. And as a child, I knew I wanted to be, I thought I was going to be an obstetrician, but life took me a different path. And so the obvious other path was midwifery.
That is wonderful. I understand, in addition to all of your accomplishments, that you also are a mother. Can you tell us about your personal pathway and journey to motherhood?
Yes. So my first child was conceived and born in my senior year of my pre-med course. I was studying in a dual program for biology and chemistry. So I actually have a biology and chemistry degree. Senior year, that April, I gave birth to one of the best gifts that God ever gave me. And so obviously I had to figure out a different course of where my life would be. But that process of mothering him, I was hungry for knowledge. I didn't know anything about the birthing process. So I studied a lot because that was just who I was anyway. And in that studying, I learned that I could do this naturally. If I sort of set my intention on that, and if I sort of honed in my perspective that at the end of this process that probably is going to be very painful or unlike anything I've ever experienced, I'm going to get this wonderful gift, right? So that was where I was. And so I was very much in labor with him for 17 hours, had him at, he was very post-date. He was 41 weeks and 3 days. Even during that pregnancy, I had preeclampsia. Back then, they they gave you magnesium, they did all the things, they stabilized you, and then 1 or 2 days later you went home. I was 35 weeks when I had preeclampsia, so I was watched those following weeks weekly with NSTs, non-stress tests. But in this day and age, as we know, I would have been delivered at 35 weeks. But back then, 27 years ago, they let me all. And I went to my baby shower looking like Winnie the Pooh, very swollen. But I looked cute. I looked like a cute Winnie the Pooh. And then the next pregnancy I had, again, was complicated. At 27 weeks, I was diagnosed with hyperemesis. I had hyperemesis with each pregnancy, but I was diagnosed with previa. And it had no bleeding, but just a partial previa. And so back then again, they put you on bed rest. So I was home on bed rest, not moving, and pretty much 10 weeks later, they said the previa sort of resolved. So I actually went back to work at 37 weeks, and at 39 weeks and 5 days, I went into natural labor. Labored at home. I was smart then. I was a labor and delivery nurse. So I was like, I got this. So, labored at home and, like laid out in the bathtub and just sort of really went into this space of like, I went inward, and it was so beautiful. Laboring at home was beautiful. But when I felt like it was time to go to the hospital, I did. So when we got to the hospital, as it turns out, there was no heartbeat on my full-term daughter. And so that whole whirlwind of processing that, and it's pretty impossible to process that in that moment. But some of the things that crossed my mind, I was like, I don't want to do this. I don't want to be awake for this. I begged for a C-section. I was 9 centimeters when I got there. I begged for a C-section. I begged for general anesthesia. Like obviously nobody was going to do any of that. And birthed my full-term baby girl. And yeah, it was that. And then the last pregnancy was my baby, who's now 20. And again, it was a very stressful, complicated pregnancy with the hyperemesis, but mostly with the crushing anxiety of what this happened again. And so, from 8 weeks until they finally put me out of my misery at 37 weeks, it was crushing. I was in preterm labor with him from 27 weeks to 37 weeks, sort of stayed 3 centimeters, contracted all the time. And I'm sorry, largely I know that was due to shock and anxiety. Birthed a healthy baby boy at 37 weeks. And those are my birth stories. They were all natural, never had an epidural, never had any. I did practice hypnobirthing with my labor with my last child. And that was pretty amazing. That's a whole study of, are you even hypnotizable, right? And so, yeah, apparently so. So it's a beautiful experience. Though the pregnancy was very anxious, the labor and the birthing of him was fascinating. Yeah.
What amazing stories that you've shared with us. I want to thank you so much because not everybody goes through what you went through. Not everybody has had a stillbirth or had a child die. And that is very scary, right? It's very
Mm-hmm.
traumatizing. And,
Mm-hmm.
I want to again thank you so much for sharing that with us. I want to ask you, what do you counsel other people? Like, what would be your best advice? Um, what would be your advice to someone in your situation or who's worried about that? And did those experiences lead you on a path towards midwifery, or how does it inform your practice?
It has informed my practice in such a major way. When that happened, I was a labor and delivery nurse, and I was working at Johns Hopkins at the time. And a few years, 2 years later, I ended up as a labor and delivery nurse at that same hospital. Now, mind you, this hospital was like my growing up, like my neighborhood hospital, the hospital I was born in. It was 4 blocks from my parents' house. I would that I had such trauma after delivering her there. I couldn't even drive past the hospital. I would like go the long route to get to my parents' house. Just young, like I was young, so like didn't know what to do with the trauma. I didn't, although my mother was a mental health therapist, I didn't seek therapy. Like I just sort of used my faith to get through it, right? And like 2 years after birthing her, I ended up as a labor and delivery nurse at the same hospital. They developed this beautiful new unit. And while I was there, as soon as I got there, they all remembered me, which was mind blowing, right? And then they asked me if I would head the bereavement program for the women who had, suffered any sort of loss there at the hospital. Um, and in doing so, I did that for 4 years. In doing so, I'm supposed to be helping these women. So like I was through like a whole bereavement training. I was supposed to be helping these women, but less did they know that they helped me. It was very therapeutic for me to be able to pour into them because I, was not only in the sympathy mode, it was total empathy. I could feel what they had gone through, right? So that was a gift for me. That was how I got my healing, honestly. And so moving forward, it definitely informs my practice because I think I might be a little more aggressive with teaching people about like fetal movements and kick couch, but um, also for women who have suffered any kind of loss. So it takes me through my process again. It also allows me to still very much so pour into them in a way that they need, because I don't know if anybody really poured into me in that way in that moment, right? In that immediate phase of when it's happening. So I feel like it's a gift that God has given me, although she was perfect. I was healthy, right? And for at least a year or two, I tried to find this path. Like, why did that happen? Because I didn't have like a medical reason or whatever. So then God sort of gave me this spiritual reason that I'm sorry you had to go through this, but you're going to be able to help so many women with your story and help so many women just get through, right? And know that they can come out on the other side and that you will smile again. Mm, sorry. Yeah, you will smile again. Sorry,
What
got
an
emotional.
amazing
I
gift.
didn't want to.
Yeah, what an amazing gift that you give to women who are going through such an emotional time. Not even just emotional, but like it really can really influence just someone's perspective on life, on
For
bringing
sure.
life into this world. And it's a lot of things that people can't relate to because most people
Yeah,
haven't gone through that type of loss. So
yeah.
I think that you are in such a unique role where you yourself experienced it, but you also have the obstetric knowledge. And so it's just such a gift that you are providing to the women that you have the opportunity to interact
Good
with.
dream up. Yeah.
Yeah.
Sorry,
Um,
I was trying so hard not to get emotional, but it's in my soul. Always be in my soul. So
Absolutely. Thank you for sharing. And I know that's
you're
such a
welcome.
vulnerable thing to share.
Yeah.
Can you tell us a little bit about the process of how you actually like your training to become a midwife and like what
Yeah.
is your practice now like?
Okay. So, in most states, you must become a nurse before becoming a midwife. And so, I became a nurse. So I went to nursing school right after I had my oldest son, um, and because I was sort of in this path that I'm going to become a midwife. So I went into nursing knowing that I would become a midwife. And so I worked in nursing for 10 years though, because I was sort of busy raising and birthing children in that process. And then shortly after and so my practice with regard to labor and delivery nursing was obviously I worked at Hopkins for 5 years. So it was like wild, you guys. Like I saw all the things like nobody was healthy. Everyone was sick. Everyone had they were birthing a baby with some syndrome like that was yet to be written about. Like it was amazing. That was how I cut my teeth, right? In the OB world. Phenomenal. And so like that's my high risk OB the background is from labor and delivery nursing at two like very high risk hospitals. And then I became a midwife, and that exposure to normal birth was fascinating to me too. I'm like, what's about to happen? Like something's about to happen in your pregnancy because like, like I'm used to sick women. And so but to see like the healthy, normal, physiologic birth come to fruition was amazing to me during my midwifery education. So I went to Philadelphia University, which is sort of this hybrid program of um, you're going to the campus to learn, but you're also doing some learning online, being educated online. And I think it was probably like before like it became a thing like in COVID, that's like a normal thing, but that was very different then. Um, and then training at a facility or birth center close to you. So I trained in the birth center, I trained in a fast paced, high birth volume hospital. And so this was it was a very rich training that I got, and that was a 2-year program. And then eventually, like I said, I got the doctorate in midwifery. This was an inaugural program at the same school where I got the master's in midwifery. Um, and I was sort of patiently waiting. I waited for 7 years. They said, as soon as we get it, we're going to let you know. And you apply, you do all the things. And thankfully, I got admitted and was in the inaugural class. And it was an amazing educate. It really was an amazing education. It opened my eyes to even like organizational structure and the business of midwifery. So that was my path. Did I answer your question, Ajima? I got caught up for a minute. Okay. Yeah.
Yeah, you answered it.
Okay. I've had so
So
many degrees, I got lost for a second.
I know, I bet. That's sometimes how I'm like when I'm trying to think about how I know people, I'm like, what path of my
What
life
school?
are you on? But can you explain to us and to the listeners, like what's the role of a midwife? Like what role does that entail? And how does that differ from other healthcare providers in the same field of obstetrics, right?
Yeah.
We talked about that a little bit prior to the recording about some of the things that people think you hold, and
Yeah.
like we want to just clarify that for people who may not know what it means to be a midwife.
Right. So I get asked all the time, are you an OBGYN? Are you a doula? And these are all birth workers, right, that have different role paths of education, different things that they do in the birth world. So how I differ from an OBGYN is OBGYNs are physicians who, as you know, you go to medical school, you do a residency, some do fellowship, um, and you are trained and educated to obviously do normal births, but you also do very high risk, medically complicated pregnancy, birth, GYN, all the things, right? And you do surgery. The only surgery that I personally do, is circumcision. But other midwives do biopsies and colposcopies and things like that. So, but we differ from physicians in training and what we actually are um, uh, allowed to do or trained to do. A doula is a person who is trained to coach a birthing person through their pregnancy, labor, and even postpartum phase. But they are not medical professionals. They don't give medical advice, or they shouldn't give medical advice. Um, Unless they're like you, Dr. Thomas, which they are a physician and a doula, then you can flip the head around. But in most cases, they are wonderful coaches, and even advocates during the birthing process for the birthing person. So, um, and then we talked before the recording that there are even different types of midwives, right? So I am a certified nurse midwife. In my role, again, like I said, I had to become a nurse first and then a midwife. And I can practice anywhere in the 50 states of the United States. Then there's the certified midwife who does not have a nursing degree, might have a degree in psychology, and they, go to a midwifery program and become a certified midwife. We basically are governed by the um, ACNM. We're governed under the same governing body, and actually credentialed, take the same exam under the same exam council. And but the difference is those who hold a certified midwife degree can only practice in, I think now it's 11 states, because most states, like I said, they want you to be a nurse first. And then there's the licensed midwife, or the professional midwife, certified professional midwife. These folks who practice with that licensure they cannot practice in a hospital. They are practitioners in home birth or birth center birth. They go through a course that I believe is 2 to 3 years. I'm not like an expert on them, but I do have friends that have gone that route. They go to a school for about 2 to 3 years where they do an apprenticeship, and they capture a certain amount of births, and then they take an exam through their governing board and become certified professional midwives. But again, they cannot practice in the hospital. They do not have prescriptive authority. And then there are women and men, I suppose, that are just apprenticed by another midwife, probably sort of how my great grandmother did, where she learned from someone and it, passed it on. But they are often called lay midwives, or um, grand midwives, as I like to call them, but they're not legally allowed to practice. So a lot of times it kind of is, covert. So that's the sort of differences, I believe, in certified nurse midwife versus other type of midwives versus doulas and OBGYN physicians.
Thank you so much for breaking that down.
That's like
For
a
me,
dissertation, seriously.
yes, I've heard it many times, but like every time I learn something new and I understand it a little bit better. Because there are so many people that can support women through the birthing process. So it's important to know, who are all the different players, and, what are their pathways to this, to this moment of helping
Yeah,
someone through birth experience.
yeah.
Um, so I wanted to ask you, for women who are expecting or expectant mothers and are considering all of those different options, between um, a physician, OBGYN, a certified nurse midwife, what are the benefits of midwife led birth experiences?
It's good. So, midwives are the masters, the gurus of like normal physiologic birth, right? So if you are someone who you're super healthy, you have no pre-existing conditions going into your pregnancy, you're very low risk going into pregnancy. So that would be a tight window of people, right? Because everybody's coming in with something: obesity, advanced maternal age. Like you were told once that you have a few high blood pressures, right? But I feel like for most women now, you can, seek a midwife and be sort of triaged to see if you are appropriate for a midwife. And then you also have to ask yourself, like, do I want to birth in a hospital? Do I want to birth at home? Do I want to birth in a birth center? And that will be the determining factor, I think, as to whether or not you want to seek midwifery care, because we do practice in all settings. I right now am only practiced in a hospital, but before I moved out here to California, I had a very successful home birth practice in Maryland, Baltimore. And again, I've also worked in birth centers. Well, briefly worked in the birth center out here, but I've trained in a birth center, I should say. So I think an individual birthing person or soon to be birthing person, or even thinking about birthing, becoming pregnant, should ask yourself questions like, do I want a natural birth? Am I the person that's like, nope, sign me up for that epidural immediately, like ASAP, stat? You don't want to do a birth center birth or a hospital birth. I mean, you could, but you're gonna like pretty much flunk and say, take me right to the hospital. So I think it's important for people to evaluate themselves in seeking which route they want to go.
So when you think about like a typical appointment that you might have with a patient, you were mentioned earlier the importance for you of empowering patients and making sure they're. Can you take us through like what are the key things that you do in appointments with patients, kind of help them through their pregnancy and their birth journey?
Yeah, that's so good. So you work with me, like I have certain requirements, like I'm not rushing through visits. So this sort of appointment is going to be this amount of time. Like you're not going to shortchange me and give me an initial, like an initial pregnancy visit and tell me that I need to do it in 30 minutes. Nope, not happening. So it's a requirement that first of all I get an hour with that sort. So let's do that, like an initial OB visit, right? So that's an hour long, give or take. So the patient is triaged by my nurse and she gives me a little background information, but I've already sort of studied this patient if I have the intel to do so. I have, my mind works in outline. So I'm already like in my mind in outline mode, medical history, surgical history, gyne history, OB history. So I know those things when I'm walking in the room. I know roughly like how far along they are based on their last menstrual period. And so when I'm walking in, I don't have to ask a tremendous amount of questions. It's just sort of like clarification questions. And then I open a space at that point in time for initial questions. And then I sort of take them through. We're very blessed that we have this sort of uh, handbook, birth Bible. I don't know what you want to call it, but this wonderful, the gray folder is so amazing. So I walk them through the gray folder, which is super educational. And oftentimes many of their questions are answered out the break from the birthing, the folder that we give them. And just so folks who are listening who don't know what the folder is, the folder goes over like, what can I eat? What can I not eat? What medications are safe to take if I have a headache? If I have insomnia, if my allergies are acting up, like all that page 9, right? Then there's a breakdown of who are you going to be seeing during your pregnancy and what are our individual like birth philosophies. What are our backgrounds and our birth philosophies? There's a huge like entire one sheet page on what is a midwife, because again, being a unicorn, a lot of people don't know. So it breaks it down, like that's page 1. Because a lot of times they're seeing me for their initial visit and they're like, who are you and what are you? So out the break they get that education. So I see, and then there's like what to expect each trimester, including your postpartum phase. When should I submit disability forms? I mean, it's very well broken down. And so I sort of like highlight the book, and then we do the wonderful physical exam, which includes an ultrasound, which is always so exciting for the family. But I was like, it never gets old for me. It's like every time, like delivering a baby never gets old for me, but like the ultrasound and seeing this new little nugget and the heartbeat and the movement, it's just like, it never gets old. And so that's always like the highlight of my day, is seeing that. And then I often step out and I'll let, the woman, the patient, get dressed, and then I come back in and there's like 30 minutes of what are your questions? Right. And I just offer that space for the patient and the partner or whomever's in the room to just ask whatever questions they need. And I think that's important, especially with Black and brown women, where oftentimes, this is just my philosophy, that a lot of the morbidities and mortalities that happen in disparate numbers in these communities happen because they are not heard. And I can attest to me personally not being heard, but because I know how to navigate the system, I'm heard, right? But folks who do not know how to navigate the system are not heard. And so things get missed. And when it's finally diagnosed, it's stage 4, right? So I pride myself in listening. I talk a lot too, but I listen a lot as well. Because you gotta talk, the information share, right? And then that way that person can be the best consumer, because they're very well educated and they can make appropriate choices. And I'm a strong proponent for shared governance. I'm not going to tell you, you must. I will tell you, this is what you have before you. Here's the intel, and then they can make an informed decision based on the information given. So it's optimal shared governance of their care.
I think you already answered my question that I had next. And it was about the inherent unpredictability of labor and delivery, right?
Yeah.
So many different scenarios that could happen. It's hard for someone to kind of know what, if this, then that, if that, then I'll do this.
Yeah.
So how do you ensure that your patients feel empowered and informed to be able to give informed consent, during the laboring process that in of itself is sometimes can be complicated and sometimes can be what one is not expecting to happen?
Yeah, I think being really clear in, like you said, it's this then that. I'm a very direct person, so I will information share concisely in that emergent moment when, okay, I'm seeing repetitive decels and we're remote from delivery. I'm very concise. This is what's happening. We've tried this, we've tried that, we've tried this, and it is not working. I'm calling my colleague and because I believe that the best thing for you is to have a C-section. What do you think? It's like, I try not to be manipulative, but I have to state the fact, right? And I've already started working in the background, getting all the folks in play, but I want her to see, okay, this is what's happening. And it's just here, if we don't, then there's the potential for the situation to get much worse. So I believe being direct, honest, concise, but meanwhile already working in the background. Anesthesia is on the way. My backup physician is on the way. My nurses are already pulling things down and things. But just giving that woman the information and then letting her make the choice is so optimal. And that goes across the board. That could be for anything. Like, we have patients all the time. They're like, no, I don't want my water broken. And I'm like, in my mind, I'm like, if you let me break your water, we'll have this baby in 17 minutes. And your pressure will be relieved, right? So, but I just again, if you don't want that, that's your body, your choice. And that's not something that immediately needs to be done, but dang it, it would make the process like, it would relieve your pressure and just make the process quicker. But I'm on your time, baby. I'm right here with you. So yeah, and I think that's what midwives do. It's like, you know, we're gonna be there, whatever choice you make, right? Because it's your body, your choice. And I know personally, I'm a huge proponent for respectful maternity care. I'm not touching you without your consent. I'm not allowing anybody else. I'm kind of protective. I'm not allowing anyone else to touch you without your consent. So I think that's a gift that midwives give and often share when we're teaching, because I've taught many OB residents, and pray that they're out there still using the tools. I know Kamisha was trained with midwives, so.
I was definitely, and that's why we felt very strongly that we needed to have a midwife in our practice,
Yeah.
because we know all the things that you can offer and contribute to a patient's care. And in that vein, I wanted to ask you to share, like, what's your approach to pain management during labor and birth, and how do you counsel someone who is seeking a natural childbirth experience?
Yeah. Honestly, that's one of those questions that I start asking early in the second trimester. Like how do you foresee your birth process, right? Because you have to know yourself. And I just get their juices flowing because they don't know, right? A lot of times. Or maybe they've had a previous birth and they're like, I absolutely want to try a natural birth. I don't want to do an epidural. I have back spasms as a result of it, whatever. Or they're like, oh, that epidural was amazing. I'm going right for it. So I'm, first of all, just getting people like thought process going on, what do you want to do, right? You know your own, maybe you don't know your own pain threshold, so let's start evaluating that now. And I also share like the tools, like if they're committed to like a natural unmedicated birth, um I share with them, okay, well, we need to start figuring out some things. I share with them some of the things that I do, or I have done. So hypnobirthing, aromatherapy, having a doula, who can, provide all of the tricks that they have in their toolbox, right? Not tricks, but the tools that they have in their toolbox. There's like taking childbirth education classes. There's so many of those. We have them at the hospital. Then there's Lamaze, the old school Lamaze. There's the Bradley method, where the partner is like the support person that helps them to navigate their labor. So I just share the tool, but I do it early. Like I don't want to wait until 36 weeks to for them out. So I start kind of like in the second trimester, sharing what I know, sharing resources, and then they can make an informed decision on, yeah, all of that sounds like I'm not even with it. I'm gonna go ahead and run that epidural for me, please. Right. So, or they're like, oh, hypnobirthing sounds amazing. Let me sign up for a class. Right. So you do it early.
So you brought up that, the topic about the tools
Yeah.
that different, people who are part of the birth process have. One thing I really love about midwives is that if there is a labor that just seems like it's not really progressing, or the baby's not positioned well or something, the midwife knows exactly what to do. So are there any particular like tips that you utilize during when you're managing labor, that you would be happy to share with our listeners? Because some people may not have the privilege of being taken care of a midwife, but at least to like just know some information that if it did happen in their labor, that they could like collaboratively share with their birthing team to maybe
Mm.
help them in their process.
Yeah, absolutely. So I mean, it's multifaceted. So if there's a birthing person who doesn't have an epidural, right? I strongly encourage movement. I mean, get out of the bed, move, squat, knee chest. That is actually my favorite position to push in birth, and is the knee chest, or on all four position. That is my favorite position, to catch a baby. But I definitely encourage movement. if the patient, if the birthing person has an epidural, though, we're limited in that. Although I have switched people with an epidural into C-checks, so, but movement in the bed, not being flat on your back, using the peanut ball, which is a peanut shaped balloon sort of ball that if you place a birthing person on their side, but almost, I don't know how to describe it, but one leg is up on the balloon, and it sort of forces a long arc rotation on a baby that is OP or facing up. So, and there are little signs that we can tell when a baby's OP. Like, first of all, me, I can look and I see me, so I'm like, OP. I don't know. I just have this midwife sixth sense about things. But then like prodromal labor is also like something that tells me that this baby is facing up. So I'm a huge proponent of the peanut ball. But I mean, there's so many tricks and tools. I talk to the babies as well. I do. I welcome them. I keep the lights dim. I keep the noise level down. Because I'm always like, if I was a baby, I'm not going out into that cold, bright, noisy situation, right? And people sound like anxious and whatever. So I really just talk to the babies. I touch the birthing person's belly and really just sort of, I mean, it might be a spiritual connection, but I really invite the baby. Like, it's okay. Like, it's cool to come out here. You're coming out to love, right? So I don't know, like, Kamisha's been around me. She knows I have like these things. I go into a different space spiritually where sometimes I don't even know. It's like my medical knowledge, my education is there, but I'm largely being controlled by this deep spiritual Nikki that's, I don't know. It probably sounds so crazy right now, but Kamisha knows. Like, I can birth a baby, look at a baby. I'm like, oh, it's like 8 pounds 2 ounces, and right when they go away the baby, the baby's like 8 pounds 2 ounces. Like, so I think a lot of my midwifery is coming from a higher power, and so I lean into that. I really lean into that. I ask God to use my hands, use my heart, and use whatever wisdom He's given me to best care for the people that He has in front of me to serve, right? Because I'm a servant, and I recognize that this is something I was called into. I should have prefaced the whole thing with that, but that's just kind of like who Dr. Nikki is. And I also respect other people's like spirituality or non-spirituality, but I can only be who I am. Was that upon anyone, but I'm gonna be who I am because I was called to do so.
Yeah, I've definitely seen like some of your tips and like tricks is just leopolding a baby. You're like, it's gonna weigh this much, and it weighs exactly what you're
Exactly that. It might be off of like 2 ounces, every now and then, but
yeah. And then the room will just erupt because they're like, oh my God, she said it's gonna be this.
You gotta give her. I'm like, it's not even me, y'all. Like, chill on me. It's not me.
I know. That's what I tell people. I'll say, they'll be like, how much does my baby weigh? Can you scan me and do an ultrasound? And I was like, if you want to know how much your baby weighs, you should go have Dr. Nikki do a Leopold for you.
Be right on point.
Like, if they want a sweep, like a membrane sweep, I'm like, the best person who's going to get you to go into labor spontaneously
in 6 hours. Nikki, okay? In 6 hours. Don't play with these fingers.
Like, this is her technique. I've done it one time because one of our patients told me what to do because she said it was a secret, and I was like, oh, let me just try. Tell me what she did. Tell me. And so now what I do is I'm like, okay, this is Nikki's method. I'm gonna sweep you, and then you're gonna walk up that hill 2 times. Go up the hill 2 times.
In 6 hours,
and then I'm like, have a baby home and have a castor oil smoothie. And I'm like, and then we'll see. I'll see if you go into labor if you're still pregnant. So those are some of the things.
Did our partner tell you that? She told you my secret. I know she did.
Oh, I should know.
I did that to our practice partners.
Yeah,
it worked.
Tell me what she did. She's like, yeah, she did this, and so yeah, she shared your secret.
Good. Well,
also, I think the people of the first time moms that you've delivered you have probably a higher success rate of no tears
No
than I
tear.
would say the other providers,
Yeah.
like consistently, I would say. And we all, to be fair, we all believe in perineal pressure
Yeah.
and support. We
Yeah.
warm compress the whole thing. But I think we all know that position matters when you deliver a
Yeah.
patient. And
Yeah.
what we are trained, and this is what I tell patients too, is everybody's going to have a different comfort level for how they allow you to push, right? I have
That's right.
delivered someone on hands and knees standing, and
Yeah.
people don't feel comfortable with that. If you've had a traditional training in obstetrics and
Correct.
gynecology, unless you experienced midwifery, or exposed to someone who's a midwife, because I can't tell you the number of midwives that were like, let's deliver them on their hands and knees. And all of us are just like
Yeah.
uncomfortable because
Yeah.
now we have to change our mindset on where we protect, how we
Correct.
protect the perineum, where we're putting our fingers. And
Where's our
some people are
downward pressure? Where's the pervicaris in relation to where I am? All that.
exactly, right? And so everybody's going to have a different comfort level. So for most providers, that's straight on your flat on your back, knees
Lithotomy.
wide open, stretching that perineum really taut.
Mm.
And so I'll tell people if I see, and some nurses also are trained like that. That's the only way they know how to push.
Correct.
Legs in the stirrups, laying flat on your back. That's where they feel comfortable. That's where they feel safe.
Right.
And you never, on the one hand, I will tell people you never want a provider to practice in a way that they're uncomfortable with. But that's why you get a diversity in practice, right?
Yes, ma'am.
And I would say that multiple of us in our practice, because we were trained by midwives, we're willing to go there with you,
Yeah.
right? And I see a perineum starting to tear. I'm like, nope, turn. We're going to sideline it. We're gonna do something different that's
Yeah.
not causing it to tear so much. And I think midwives feel more comfortable with that.
That's it. That's it.
Push you in whatever position that you need.
That's it.
And that part of that, because you are more used to dealing with unmedicated patients.
Yes.
And the average unmedicated patient, their body will tell them what position they need to push in.
Yeah.
You
Yeah.
know? So I know I was going to ask you a question somewhere in there.
No, but that's so on point though. Like I have been on the ground. Like I've laid out a hospital blanket on the ground, a chuck, and hey, I'm under you like this. Like I really don't have a lot of like, then I can't do that. If that's where we want to be on the ground, you're refusing to get on the bed. Okay, I'm here with you, baby. And I've been on the ground on that blanket, like ready to catch a baby. I'm down for whatever. And so I think it comes with, like you said, like however that person wants or needs to birth, I gotta flow with that. And I have to learn to become comfortable with that. Yeah, it changes your dynamic in your brain, like, oh, okay, I'm behind her. So, yeah, my maneuvers are going to be a little different. But honestly, if we just left our hands off of them, the baby would still come in most instances. We don't have to do anything, right?
And that's what I think when people ask me the benefit of a midwife, I tell them they are the experts in vaginal birth.
Yes.
And when people try to say, oh, I love having you as my doctor and blah, 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 because you're willing to do this and that, I don't think they understand. It's because when I was a resident, I would sit at night and I would quiz one of the midwives. I was fortunate to be trained by a Black midwife and multiple midwives. And I would be like, what would you do in this situation? What would you do in that situation? So if you could, get to the question. Can you share with some people, like, what are some misconceptions that people have about midwifery that you encounter, and like, how do you address them?
Yeah. So, oh boy, yeah, this has been a lot of misconceptions that midwives are, like, the education part has been a huge misconception. Like, what type of education did you get? What sort of training did you get? Like, in essence, just to become a midwife, a certified midwife or a certified nurse midwife in this country, you're going through at least 6 years of training. and education, right? And I'm talking about Barney's Midwifery sick textbook, like carrying that around like that's your Bible or whatever. And so a lot of misconception, I think, is behind like what sort of education we get. But then the other misconception is that a lot of people think that we only do home birth, which I mean, yeah, I mean, cool. Like during the pandemic, that was my jam. Like I said, had a very successful home birth practice. I also, this is, I think, the biggest misconception is that I can care for a high risk patient. I co manage, right? Because I always in practice have a backup physician. So I can manage high risk. And one of the, I think, gifts that God has given me as well is this keen sense of when things are turning the corner toward high risk. I tingle. I'm like, okay, and so then I'm already conferring with my colleagues, like, look, and Dr. Thomas, I will call you like, this is what's happening and this is what's going to happen. And so because I've done high risk for so long, I think that's the gift, that I've done high risk for so long that I love normal, but I know when it's not normal, and when I need to confer with my colleagues and hand off or whatever. I still go in the operating. I'm sorry, I still go in the operating room with you. That like I'm in there. Like I'm not just gonna be like, you got it. No, I literally go in there. I'm bye. No, I literally go in there and I'm there like helping the nurses and helping my doc like get tied up, and like I'm still in there. And speaking of what you need, like I want to be a part of the whole process. And I want to see the baby that was causing the trouble anyway. So yeah, sorry.
And there are some practices where midwives assist the physician with the C-section as well.
Yes.
So it's nice that they continue to be part of the whole birthing experience.
We're
But
pushing
what
for that.
yes, what I'm most happy about this whole conversation that we've had is that for our listeners to get a glimpse to know that there are providers out there in the community that can meet their needs, that they can have the type of birth experience that they want. It may not,
Yes.
everything may not go exactly as planned, but the intention, the knowledge, it's all there.
Yes.
So really like seeking out those providers that align with your philosophy, your
Yes.
goals, and most importantly that you feel comfortable with.
Yes.
Because that's how people, I feel like, have safer birth experiences, because they can
Absolutely.
speak up, they can ask questions.
Yeah.
I wanted to know, are there any other words of advice or anything else you want to share with the Birth Squad?
Yes. First of all, I'm just so happy that you guys have invited me to have this conversation about midwifery. I think collaboration between OBGYN physicians and midwifery is such a beautiful thing. Even when I was doing home births, I still had my mentor who, the OG OBGYN that always covered me, right? And so like having this connectivity is such a beautiful thing. And I just hope that there is more of it, because there seems to be such a separation, especially with midwives that work in the community versus the hospital. So I think it's one of the gifts that we have in our practice is that we do invite partnership with community midwives, right? And so that they do have a backup place to go if they're in the community delivering and things get rough or they need to transfer the patient, right? We do have that privilege of sharing this collaboration. So I just wish that there was more of it. And that's kind of what I wanted to share with the Birth Squad. If we could just share more of it and even do more information sharing and education with the, offer conferences for the community midwife to be able to come to and get up to date on like, the latest things like we do in the hospital setting. So I guess I'm a unified, I'm a person that pushes for unity in most situations. So yeah. But thank you guys so much in this opportunity to speak on what midwifery is, and to highlight that, yeah, there are a few of us unicorn Black midwives out there doing the work and loving it. Like, don't tell anybody, but if they didn't pay me to show up to work, I would still show up. Like, but don't tell them. I want my paycheck.
You need your paycheck. You should get paid.
Yes. Okay. Right, run me my money, but.
So, again, thank you so much. We want to ask, where can the listeners find more information about you and your services? How can they get in touch with you?
Oh, fantastic. So you can reach me at USC Verdugo Hills Hospital. The phone number is 818-658-5980. I will say that again. It's 818-658-5980. You can also reach me directly. I'm one of those people, like, I'm cool if you email me. So Dr. Nikki, CNM, at gmail.com. So that's DRNIKKICNM at gmail.com.
Thank you so much. You have been amazing.
Yes,
I've
sure.
learned so much from you today. And I just really appreciate you being here with us and sharing all of your knowledge.
Thank you, ladies, so much. I appreciate you guys. Thank you so much for the invite.
She's trying to blow up our practice right here.
You heard me, 818, baby.
I'm like,
oh, like this, like, damn.
We'll do what we can.
Like, come on, let's get it.
All right. Well, take care and have a great rest of your day.
Thank you.
Bye.
That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts of your experience, and we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad, and check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Ogwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from the Birth Squad.